This is Dr. Thomas Klein. I'm a specialist in people with painful diseases, of which there are 10 million in the United States. Approximately 70% of those have been taken off or reduced of their pain medicine because of an overall governmental fear that the more pills you pass around, the more people will become addicted and die from overdoses. And we know that's not true because opiate addiction is different than other addictions. It's controlled by genes. Alcoholism, amphetamine abuse, and stimulant abuse, those are not controlled by genes. If you want to find out more about this, I did write a little paper, me and some other people, and you can Google the words medium, ABC, addiction, Klein. And you'll get the paper we wrote that for the first time, our group JATH, J-A-T-H, Educational Consortium, has described that there's two broad categories of addiction. Opiate addiction is different than the other types. The other types, more substance, more addiction. Opiate addiction, the more substance, you do not increase the rate of addiction because it's triggered on the very first pill. Ask any addict and ask any opiate addict. And there's about 5 per 1,000 heroin addicts currently in the United States by government statistics. And that's the same as it's been since 1920, 1950, 1970. Worldwide, guess what? 4 people per 1,000. People that work in the Golden Triangle growing opium, 4 per 1,000. In Canada, 4 per 1,000. Portugal, UK. It's astounding, really, that if a disease has a fixed prevalence, that means you got the same number of people everywhere with the disease, it cannot be environmental because environments are different. If it was environmental, yeah. Now, if you look at the incidence of cocaine abuse or stimulant abuse, bounces all around. It's different. But not for opiate addiction. We have made an enormous mistake. 1 person out of 100 will steal drugs from a pharmacy and sell them to get a lot of money. A bottle of pain medicines can fetch anywhere from $3,000 to $10,000. But there's only 1. So in other words, it's all true what everybody's saying. It's the matter of degree that's different. If only 1 person per 100 is stealing pills, are we going to punish the other 99 and take their medicines away? This is unbelievable. This is like something out of a bad movie. So if you take the pills away from all these people, you're going to stop addiction? No. In 1925, they stopped heroin, and gee whiz, seems like we still have the same problem. It gets worse every month, and I wanted to talk about dogs. Maine passed a law in 2017 that says all veterinarians need to register with the Prescription Drug Monitoring Service. This is a national spy network for people and doctors to track every single opiate pill. If you got a prescription for 2 opiate pills 5 years ago, you will be on that computer forever. So here's how it works. The vets now have to check the PDMP for the dog's owners. If the dog's owners are taking opiates for pain, they won't give you any opiates for your dog. So now the dog gets to suffer along with 7 or 8 million people who have been cut off at the urging of the government, CDC. And here's what's worse. The law says you have to check the MME, which is the total dose. Now, we've talked before about total dose. The FDA has no total dose. And it doesn't matter, the FDA said, because you can have as many problems with low dose as you do high dose. So there's actually no federal, state, or local entity that limits the quantity or dose of opiate pain medicine. Now there's one teeny little exception. The FDA puts a dose limit on tramadol, which is some kind of funny opiate most people don't use, although doctors think it's not really an opiate, so they use it a lot. There is so much ignorance out here. We are in the midst of a scientific nihilism movement where all science is just out the window. Now, my man here, Socrates, is in charge of logical thinking, and we don't have logical thinking. And we've got a lot of people, a lot of Americans in this country who have been screwed. They've had their medications taken away on purpose without their consent because doctors are afraid the boards, the medical boards, will come after them and do bad things. Gee, maybe there's more to that story, which we'll have in a couple weeks. So, dogs. This is how far things have gone. Who's pushing this? That's a good question. There are anti-opioid forces that approach a zealotism that's just something to behold. I know that there are some anti-opioid groups that actually go to state governments and kind of infiltrate and say, oh, you know, we're doctors, and oh, if you stop giving these pills, you won't have any overdoses. What did Socrates say? When the CDC guidelines were published, there had been a huge drop-off in the number of prescriptions, 15% over 5 years. Did that stop the No, the overdoses were increasing. So we got to ask more questions. That's what Socrates said. If you ask enough questions, you can get at the root of the problem and you can solve it. Millions of pills. Did you ever read in the paper that a doctor was raided and the doctor had prescribed 500,000 pills? First of all, raids by the DEA are of two types. One is an administrative raid, which basically they're coming to look at records, which they have the right to do. When Medicare does that, they send a letter. They sent me a letter once, and they sent them charts, and they looked at them, and they said, "Fine, you're okay." The DEA could do the same thing. But what their excuse is, the doctors will suddenly shred the documents, you know, like at Enron. We're not going to shred medical records. Plus, if they really wanted to, they could send over somebody in plain clothes and lock the cabinet and then come back and sit down in the office, go over everything. They don't need to come with sirens and lights. The second kind of thing is their other function. They have two functions, regulatory and enforcement. So if they're coming with a real live search warrant, that's different. They go in, they can take whatever they want, but most of the raids you read about are just to retain records. No guilt. A lot of times the records are taken up to the DEA office and they hire a doctor and they go through them and find nothing wrong. That's what Medicare did with me. All government agencies have the right to do that if you receive money from them, which we do as doctors. So, let me give you an example of these millions of pills. Vicodin comes in a 15 milligram tablet, and so does oxycodone. Those are our two most used drugs. A child would take 15 milligrams. An adult with painful disease would need 60 to 90 milligrams per dose. But they don't make a bigger pill, so you got to take a whole bunch of pills. And worse than that, these drugs you have to take every 4 hours. There's very few other drugs you have to take every 4 hours. Aspirin, but not many prescription drugs. So you end up having to take a lot. So let's say we have the case of Clara, and Clara has adhesive arachnoiditis, an absolutely horrible permanent disease from people shooting steroids in their spines. And so she needs 60 milligrams, which is not a big dose, of of the 15 milligram oxycodone. So that's 4 pills. Then she's got to take them every 4 hours. So that's 6 doses. 6 doses times 4 pills is 24. And usually you read in the paper that over the last 2 years, this man has prescribed 500,000 pills. But if you calculate how many pills Clara is going to take during the year, and let's say a small pain practice would have 100 people. Actually, there are 500 to 1,000 people in these practices. But let's say there's only 100. So then you got 100 patients the doctor sees and gets the same dose. Over 2 years, you have prescribed 1.7 million pills. Do the math. So what's wrong with that? So that's being used as profiling. What is profiling? Oh, there's 4 black guys on the corner. They must be a drug gang. No, actually they were out doing church work. But that's called profiling. Profiling is unconstitutional. In this country, you cannot go after people because they look suspicious. So what's a red flag? Dr. Klein has out-of-state patients. That's a red flag. So it isn't something that's just automatically a crime, because it's not a crime. It's a suspicion. Profiling. Dr. Klein has out-of-state patients. So he's profiled as a pill mill. There haven't been any pill mills in this country since they were busted in Florida 10 years ago. None. But it lingers on. So how many red flags are there? Well, we're going to do a little session on red flags. It appears that there are about 80. But these are just suspicion. In this country, we do not do things to people because of suspicion. Oh, you've got these pills I see here on the computer. We're not going to treat you. That's against the Constitution of the United States. You don't do things to people because they look suspicious. Wash your hands. It'll stop the coronavirus. And good night.